So speaking to quite a few people about brain spotting, two themes seem to come up. One being the lack of drama in using this approach that we see with clients, and also that there's not always the need to go into the story. Can you say a little bit more about that?
Okay. Well, firstly, a key rule in brain spotting is we take a kind of a not-known position. We really know that the client is the expert and their brain is the part that's going to be doing the healing in the brain and in the body. So we don't like to make predictions about how everybody's going to respond, because everybody is so different in how they heal. But it's an interesting point you make, because often people will say with brain spotting it's less traumatizing. The reactions are less so they're going into the deep activation, which is sometimes what we call those, what's sometimes called disturbance in other approaches. Sometimes people can go into deep activation and work through it in a way that's a lot more manageable, a lot more where they feel more in control. There's a dual awareness that what's happening in the body is important, but also they're sitting beside it and noticing it at the same time. So that can be really, really helpful. Also, you mentioned something there about people not having to give a full narrative or story about what's happened to them. Well, when we consider that a lot of trauma might also be in the parts of the brain that were there long before speech was even developed, then people sometimes either can't or don't want to put their story into words. It might be something that happened as a baby or something that happened in the very early formative years, so there might not be a verbal representation of that. One of the real strengths of brain spotting is that because it's such a brain-body focused piece of such a brain-body approach, that we're working deep into the subcortex. This is the part of the brain that holds all the emotional information, rather than the part of the brain that holds all the verbal information, the neocortex. And as we believe we're working deep into the subcortex, we can still process the emotional material that needs to be worked through without it having to be spoken about and have a whole narrative around what's going on there. And people will often say, after some brain spotting sessions, that they've noticed changes they didn't even know they were working on, because we're working deep into those subcortical or non-verbal parts of the emotional brain.
Great, thank you.